Hello, my name is Dr. Janice Makela, and you're watching Living Life Backwards, Lessons from the End of Life. Welcome! Today we're going to talk about hospice. Now, hospice is a fairly new field. It only came into existence in 1967 when Dame Cicely Saunders opened St. Christopher's Hospice in London. Hospice didn't really reach America until 1982 when Medicare passed a law allowing hospice to be covered under Medicare. After that, in America, hospice started growing as a field, but it wasn't until 2008 that it was designated an official medical specialty by the medical boards. Now, a lot of people ask me, where is hospice? And I have to explain to them, it's not a place, it's a program. Hospice happens where the patient is, whether the patient is at home or with a caregiver or at a nursing home. It's for people who are terminally ill, who have generally less than 6 months to live. 2 doctors have to certify that as the case. And its focus is more on comfort and symptom control and not on cure of any specific disease. This is not the same as euthanasia or assisted suicide. A lot of people think that when a person goes on hospice, we just hook up the morphine drip and the person dies soon after. Nothing could be further from the truth. We don't do that. Euthanasia, physician-assisted suicide, those are completely different things than hospice. We focus more on keeping a person comfortable as long as they are alive. We control things such as pain and shortness of breath, nausea, vomiting, diarrhea, constipation, things that can be very uncomfortable in a person's last days. And we work to make sure that these symptoms are addressed and treated. Hospice has a whole team of people that help with this. We not only have doctors and nurses, but we have social workers and chaplains. Pain is not just a physical symptom, but is an emotional symptom too. Suffering is a component that can make pain much worse than you might otherwise experience it. And so a good hospice team has a social worker and a chaplain to deal with the psychological and spiritual suffering that might be associated with the dying process. There's also volunteers who come to be with people who need extra support. And there's even things like music therapists. Hospices generally have inpatient hospice units or inpatient hospice beds in a hospital that they use for patients who have very severe symptoms that need very close monitoring by a nurse and usually a doctor every day to make sure that they are comfortable. If a person can't or won't go to an inpatient unit, there's also a program called continuous care where there's a hospice staff member at the bedside 24/7 to monitor these symptoms and make sure they're treated appropriately. After the patient dies, the hospice provides bereavement services. That is, they check in on the significant loved ones of the person who died and make sure they're doing okay. And that is a brief description of what hospice is. If you have questions about how that might apply to your own medical care, I would suggest you talk to your own doctor about that, as these videos are just for educational purposes only. If you have any other questions or any suggestions for future lectures, leave them in the comments below. And of course, hit the subscribe button if you want to see other videos. Thank you.